We don't have a quorum yet, I don't believe. We don't have a quorum yet. We'll ask the sergeants to please call the members of the committee so that we can establish a quorum for this particular meeting today. This is the Assembly's second extraordinary session Finance Committee of September 4th, 2015. Members, today we're here to consider one bill that has been referred to the extraordinary session, special session. I want to recognize the special session was established to address some thorny problems relating to the extension of managed care tax, as well as the need to find a funding source to increase the rates for Medi-Cal and developmental services. We've held several hearings regarding these issues during the budget process this spring, as well as in the policy committee in this special session, and we continue to work on finding a solution to address these problems. However, this hearing is not about one of those, but broader discussions. We're here to discuss the fiscal aspects of one bill, which is AB 2X15 by Eggman. This bill was the subject of an extensive hearing earlier this week in the policy committee. We're here today to consider the financial implications of the bill, and I want to focus on that, the financial implications of this bill. The Department of Finance has informed the committee that they have no file on this bill at this time, so that the office does not plan on commenting concerning the finances with regards to this bill. Therefore, for the hearing today, our agenda will consist of first, since it's our very first meeting of the Finance Committee, we have to adopt the committee rules. These rules are essentially the same as the rules of the Budget Committee, but do not include reference to subcommittees and committee deadlines for bill referrals that do not apply to the special session. After that, we will go directly to the bill itself. Per prior agreement, Ms. Eggman, the author of the bill, will present, and then we will allow 10 minutes of testimony in support of the bill, 10 minutes of testimony in opposition to the bill. Given this is a fiscal committee, we are asking those testifying on behalf of the bill to limit their focus to the fiscal impacts on the bill rather than the policy implications. After that period of testimony, other members in the audience may comment publicly by only basically identifying their name, affiliation, and their position on the bill. After that, we will allow member questions and then have a vote on the bill as whether or not it will go forward to the floor. Before we begin, I'll ask if Ms. Melendez, my vice chair, has any opening comments.
I do. Thank you, Madam Chair. I'm honored to have the opportunity to work beside you in this extraordinary committee, and I hope that we're able to work together to improve our healthcare system through innovative solutions that do not place additional burdens on taxpayers. I do want to note, however, the bill we are considering today does not seem to fit the purpose of this committee. I will not read the entire statement that the governor made when he convened this extraordinary session. However, he did say that the main purpose was to strengthen our Medicare, or excuse me, our Medi-Cal and developmental disability programs. So the fact that we are hearing this bill so quickly is a bit concerning to me. Earlier this year, this very same bill failed in this very House. I agree with the governor's forewarning a few weeks ago that this committee is not the appropriate venue for this major law change. This policy matter should be thoroughly thought out, should be vetted in committee, and have extensive deliberation, not injected into a special session. With that, Madam Chair, I will yield the floor.
Thank you very much. Are there any other members who'd like to have any opening comments? Okay. We do have a quorum now. Will you please call the roll?
Weber.
Here.
Melendez. Here. Bigelow. Bloom. Gomez. Jones Sawyer. McCarty. Obernolte. Ting.
Thank
Quorum
you.
is present.
With that, I'd like to have a motion to adopt the rules for the Finance Committee. Second. It's been moved in second. Roll call.
Weber.
Aye.
Weber, aye. Melendez. Melendez, aye. Bigelow. Bigelow, aye. Bloom. Gomez. Jones Sawyer. McCarty. Obernolte. Obernolte, aye. Ting.
Aye.
Ting, aye. Ayes. Ayes 5, no 0.
Okay, fine. Thank you very much. That the rules for the operation of the committee are approved. At this time, we'll present the bill itself. Ms. Eggman is here to make the presentation of AB X2 15.
I will be brief. Today I present AB 15, the End-of-Life Option Act. This bill provides an adult with a terminal and incurable illness the opportunity to end their life in their final days. In order to obtain the drug, a qualifying adult must initiate the request themselves. No one else may ask for that. Make a second oral request at least 15 days later. Submit a written request in the presence of two witnesses. Confirm that they are making the request voluntarily, and then consult with yet another physician. The End-of-Life Option Act contains many protections from coercion for individuals who choose to participate. The Act also provides protections for physicians and hospitals that either choose to participate or not to participate. Recent amendments to the bill were addressed to address protections for family members or other loved ones who are present in the room when an adult ingests the aid in dying drug. Additionally, amendments were added to clarify that healthcare providers who do not participate with the Act in good faith may be disciplined by the medical board or appropriate licensing board or agency. The fiscal effects of this bill are very modest. Amendments have been taken to reduce the cost for the Department of Public Health, the Department of Managed Healthcare, and the medical board. The anticipation, although we don't have a report from Finance today, is less than $300,000 in the first year, and this is only to begin the process for collecting the data that we think is very important. I'll also add that we are also taking an amendment to do a sunset in 10 years so we can come back and take a further look at this. I'd like to introduce my witnesses who are here in support. First off, we'll have Tony Brodus from Compassion and Choices, and then Dan Diaz.
We'll ask each one of you to introduce yourselves and collect together. You have 10 minutes total.
Thank you. Good morning. Can you? All right, great. Good morning. My name is Tony Broadus, and I am the California Director for Compassion and Choices, the largest and leading national organization working to provide support, education, and advocacy to improve end-of-life experiences and care for dying people. We've been doing this work for over 30 years and have significant experience in states where similar legislation has been passed. We're here because dying Californians need an option that they currently do not have in our state, and because those Californians, many of those Californians, have been using their precious last days to ask you to spare other Californians from the painful dying process that they see ahead of them. But we are in this committee, the Finance Committee, to determine whether the cost of passing this legislation is reasonable and necessary. I'd like to offer a few brief points in support of that conclusion. First, these costs are associated almost entirely with the collection of data and publication of an annual report. This is necessary to provide accountability and ensure that California's law, just like Oregon's law, is working as intended. Thanks to ongoing efforts to improve this bill over the previous version of it passed in the Senate, the costs of implementing the End-of-Life Option Act have decreased significantly as put forth in AB X 215. By including statutory compliance forms and streamlining agency reporting requirements based on conversations we've had with other states who already do this, ABX 215 has reduced initial projected implementation costs by over $500,000. So we'd like to thank the members of the Assembly for taking those amendments and working to help make this bill not only stronger but less expensive for the state. Second, I'd like to note that even these projected costs may be high. Although we do not have data has not been tracked about the costs in other states, we do know that the actual annual cost of similar laws in Oregon and Washington are actually less than $25,000 a year. Oregon's public health system estimates that 2 employees spend only a small portion of their time to analyze the data, produce the report, answer press calls, and general inquiries about the law. So once the implementation is in place and the systems are in place, we think it's very likely that
the costs will actually decrease over time. And we'd also like to point out that if the law is working as intended in 10 years or 15 years, the data collection could be significantly reduced and streamlined even further. Finally, I would just like to note that we don't often talk about the costs of not passing this legislation, but those costs are also high. They are disproportionately high for dying Californians. In the human cost as well as financial cost for families who do not have access to this option for their dying family members. Your yes vote will reduce or eliminate those human costs and enact a fiscally responsible law supported by 75% of all Californians. Thank you.
Good morning. My name is Dan Diaz, and I am Brittany Menard's husband. Last year, Brittany and I had to move to Oregon so she could access medical aid in dying in order to secure a gentle passing if it were to become necessary for her. Had we stayed here in California, the brain tumor would have ended Brittany's life in a brutal manner. She wanted to die gently and avoid the terrifying and painful death that was otherwise coming for her. Brittany passed away peacefully in her sleep on November 1st last year. There are certain diseases that produce horrific and needless suffering at the end of life. Brittany's case was one of those. Christy O'Donnell is another terminally ill Californian that is also facing a brutal dying process. Christy has lung cancer that has spread all over her body into her brain as well. Christy testified just 3 days ago here at the Health Committee hearing. Christy was a sergeant with the LAPD, and she then went to law school and became a civil rights attorney. As a sergeant with the LAPD, Christy was telling me what happens when a person does not have the option for a gentle passing. Christy shared with me the tragic scenes that she witnessed firsthand, countless times where she was called to a house of a terminally ill individual that had become so distraught and overwhelmed with their own pain that palliative and hospice care could not alleviate, that they turned to drastic means. The cost of those investigations, the medical examiners, the police involvement, those are all expenses that are borne by the state and local jurisdictions. A few months ago, the CMA removed all opposition to this bill and stated that palliative and hospice care are not always enough to keep a person comfortable at the end of their life. The medical community and the state of California cannot abandon terminally ill individuals like Brittany and Christy O'Donnell to die a horrific death. No more. This legislation allows end-of-life decisions to be made by the individual and their physician, precisely as the statement by the CMA suggests. The social cost of not having this legislation are far too great. Without this legislation, end-of-life decisions are currently being made behind closed doors, typically as soon as morphine shows up in the house. The current system is one that is wrought with abuse. Where's the outrage over the current abuses? This legislation brings everything into the light of day, above board, and for the first time, this bill encourages the patient. It actually requires the patient to have the tough conversations with their physicians so they can root out any form of coercion or undue pressure. It also supports the individual so that they don't fall into a state of despair and forced to the drastic measures that Christy O'Donnell spoke about. Those drastic measures are paid for by the state and by society as a whole. We can fix that. I thank you for your support of this legislation.
Thank you very much. Is there any opposition to the bill? Any presentation? You will have a 10-minute presentation.
Here we go.
Two persons for a 10-minute presentation.
My name is Margaret Dorr, and I'm an attorney from Washington State, where assisted suicide is legal, and I provided you with materials on your desks.
Okay, thank you.
Oh, do you want me to keep talking?
I don't know who's doing the presentation.
Well, we're not coordinated, so I can...
Well, we only get 10 minutes in total.
You got 10 minutes total.
I'll go for 3 minutes. How's that? Okay, so I've given you 3 documents. One is more of a major policy document addressing some of the problems with the bill. That's not what's before you today, so I'm just making you aware of it. The second one is about fiscal matters, which talks about the high cost of suicide, which I'll get to in a moment. And the last document, number 3, is just some correcting comments that I made to some of the representations that were made by the other side in the last hearing. So basically, so you are seeking to legalize physician-assisted suicide. In Oregon, it was passed in 1997, took the stigma away from regular suicides, and those suicides, at least the statistics show, they go up every year. So contrary to what Mr. Diaz says, with physician-assisted suicide, you get more regular conventional suicides, not less. Now, the significance for the financial issue is that regular suicides are expensive for the state because people change their mind. So, yeah, I'm shooting myself. Oh, I guess I didn't quite mean it. Oh, now I'm hurt. Now I need rehab. So in my materials, I have documents from the Oregon Health Authority describing that regular or conventional suicides in Oregon for just the rehab are $41 million. Okay, that's a big figure. Now, Oregon has only 1/10 of your population. So if you have the same experience if you pass AB 15, then you could conceivably have a much higher figure. Another type of suicide, which is not tracked by suicide figures, is suicide by cop. And those can also be very expensive. I referenced 15-year-old Andy, I don't remember his name now, he's from California. He went to school a few years ago. He wanted to do a suicide by cop. He said this to a newspaper reporter 15 years later. That was his motive. And he killed 2 of his classmates. He injured 13 others, and now he's incarcerated. That's a very expensive thing for people. So when suicide becomes more acceptable, regular suicide occurs more, then it could cost the state a lot of money. Now, the counter to my argument would be that, we don't know that there's suicide contagion in Oregon. There is a statistical correlation, and that's all it is. And that's what I'm giving you, a statistical correlation. On the other hand, these numbers are so big, and it makes so much sense, especially when you see how Compassion and Choices promotes suicide with their advertising, with everything else. They have suicide parties. This is what they do. I mean, this is what happens. So it becomes very much in the newspapers. Sometimes it's filmed, watching someone take the lethal dose. So anyway, if anyone has any questions, I'm here. Other people need to talk. And thank you so much.
Thank you. You've used it 3.5 minutes so far. Mm-hmm.
Deborah Doctor from Disability Rights California, and I want to start off by saying that my organization and my board is not questioning the good intentions of this author or the previous authors. We believe that you have absolutely good intentions. We are not here out of concern for somebody like Brittany Menard and her loving family. That's not where our concern is. Our concern is for the people for whom Adult Protective Services exists, for the people for whom the elder abuse and protection penalties exist, and for the fact that 90% of elder abuse is done by family members. So unless you believe that no family member ever acts out of bad intentions, I'm asking you to think about those people too. I have to say this is the lowest cost I've ever seen assigned to any bill that had anything to do with the Department of Health Care Services. So I wish my own bills carried this kind of cost estimate. I think the cost estimate is so low because there's no proactive effort costed out for the state to do anything to find out what's going on. Just as in Oregon. In Oregon, the data we have is not complete because it's entirely voluntary. What you know from Oregon is what the voluntary reporters have told you. I think it's not realistic to think that every single case is going to somehow, all the data is going to arrive in some state office without any outreach being done. The bill lacks many protections. I know more have been added, but they're primarily for physicians who are amazingly protected from every possible wrongdoing, which is astounding to me. If you want to use Oregon statistics, you'll see that there is doctor shopping. One doctor has prescribed about 10% of the prescriptions. You'll see that several people who got the drug in 2012 because they had less than 6 months to live took it in 2014. We have, some of us are old enough to remember the wonderful actress Valerie Harper, who got a terminal diagnosis in 2013 and is performing in a stage show now. So please don't comfort yourselves with the idea that it's always possible to predict death within that number of days and hours. And you'll see more people in Oregon. There has been an increase in people with ALS who are getting this drug. And that is a disease where it is even more difficult to predict what a date of death. So I'm just saying that that's one of the holes here. The people, the physicians and the witnesses who could be somebody off the street who could have met the person 30 seconds before, as long as the patient provided identification, they are given the responsibility in this bill to judge that the patient is of sound mind. With what training do they do that? What kind of a responsibility are we giving people who might be, on the one hand, complete strangers, or on the other hand, heirs? One person can be an heir and have a vested interest in this. So these are just some of the pitfalls. I want to close by saying that people with disabilities, including seniors with disabilities, don't have full access to health care now. We have had 3 clients in the last year with developmental disabilities who have been denied medical treatments because of their developmental disability, stated that way. And contrary with respect to the author, what was said the other day, this bill does not exclude people with developmental disabilities from being able to use this bill if they also have a diagnosis of death within 6 months. So I'm going to stop now and respectfully ask you to think of the people who are the least able and the most vulnerable to possible coercion or exploitation. Thank you.
Sir, you have 2 minutes left.
2 minutes? Okay. Thank you, Dr. Weber. Members of the committee. My name is David Ford, the legislative advocate for the Association of Northern California Oncologists and the Medical Oncology Association of Southern California, both of whom are in opposition to the bill. I understand this is the fiscal committee and our concerns are largely policy. However, in this case, it's difficult to separate the two because we believe if this bill were better constructed to address the comprehensive issues that that patients face at the end of their lives, the bill would be a far sight more expensive. We would point out that we are approaching a third of our state currently on Medi-Cal where there is still no palliative care benefit. It's in process, but it is not there yet. And that those patients likewise do not have access to hospice care, likely do not have advanced health care directives. And we think, to the point Ms. Melendez made earlier, that would be an appropriate conversation to have in the context of this special session. But we're not having that conversation. We're having this one instead. So, as I say, our concerns are mostly policy. So I think I will leave it at that. And thank you for your time.
Thank you very much. I want to thank all of those who've come to give us their positions on the bill for staying within the time frame. I really appreciate that. So I appreciate that. I assume there's some individuals in the audience who are in favor of the bill. We will hear from them now. We're asking those who would like to make a statement in favor, please line up. You can give us your name, your organization, and whether you're for or against the bill.
Madam Chair and members, Rand Martin on behalf of the AIDS Healthcare Foundation in support of the bill.
I'm Susie Cohen. I'm from Sacramento, and I am in support of the bill.
Patricia Portillo. I am in support of the bill for the memory of my brother Victor.
Hi, my name is Dr. Sarah Pender. I've conversed with my assembly member Bigelow on this topic. I represent stage 4 cancer disabled person, Christy Allen, who I was supposed to pick up this morning, but she's too sick to come in. That's a reference to time. I represent 41 years with hospice as a bereavement coordinator and adult protective services as a practicing clinician. And I also represent a 45-year wheelchair-bound disabled person, Catherine McCaffrey, my mother, who died alone and in pain. And I thank you very much for your time.
My name is Shelley Bales, and I'm from Davis, California, and I'm very much in support of this bill. Thank you.
Thank you.
I'm Ellen Pontac from Davis, California. My wife, Shelley, who just spoke, and I are a longtime gay rights activists, and we know what it's like not to be able to make decisions about your own life. Please support this bill.
I'm Charmaine Manansala from South Pasadena, Catholic and a person with disabilities, and I strongly support this bill.
I'm Barbara Rady from Lodi, California, and I support this bill strongly, and I know many, many people and friends that do that aren't here. Thank you.
Meredith Minkler, former professor of public health at UC Berkeley, where I was honored to have been asked by a group of disabled people, many of them people of color, to help them conduct a study on the attitudes of people with disabilities. And what we found was that many, many people with disabilities are afraid to speak up. They believe strongly in death with dignity, the right to die, and they feel that their movement does not allow them to do that.
My name is Ron Reddy from Lodi, California, and I support the bill.
Thank you.
I'm Rita Poppink from Union City, California, and I support the bill.
Dexter Barker from Union City, California. I support the bill, and I watched both my parents die badly in hospice care. My father wanted to just close his eyes and go to sleep.
Thank you.
My name is Leslie McAllister. I'm a professor of law at UC Davis. I have terminal cancer, and I would like to have this option. Please vote in favor of the bill.
My name is Clint Abbott, and I support the bill.
My name is Christina Goodwin from Marin County, and I support this bill, and I encourage you to do so as well.
Thank you very much. We have those in opposition to the bill. Will you please come forward? You also will be given the opportunity to state your name, where you're from, and your position on the bill. For those who are in opposition to the bill.
Sandra Palacios with the California Catholic Conference in strong opposition. We are concerned for the poor and vulnerable.
Thank you.
Madam Chair and members, Nathan Mansky representing the Alliance of Catholic Healthcare in opposition to the bill. Thank you.
Thank you.
Madam Chair, members, Jason Bryant, Agudath Israel of California. We've offered 2 clarifying amendments to the compliance form. Upon receiving those amendments, we remove our opposition to the bill.
Thank you very much. Okay. Are there any other opposition to the bill? Okay. Thank you very much, those who've come today for this hearing. Any of the members have any questions or comments at this time? Yes, Mr. McCarty.
Thank you. Well, first, I know this is the fiscal committee, and we had a robust discussion in the policy committee, so I get that, and I'm supportive of this effort. But I just want maybe you could address an issue that was briefly talked about in the analysis, that if you look at the state impact on this, certainly there are some administrative issues for the oversight for the Department of Public Health, but the Medi-Cal individuals that could participate in this in California, how many people are we talking about? Maybe comparison to Oregon to paint us a picture that what great cost it could be, or conversely what not minimal but lower cost.
Well, currently Medi-Cal would not cover it. That we would have to
if we did
cover it. Well, the highest cost that I don't want to make the case that this. I will say that the most expensive form of health care happens at the end of one's life. And if someone is on Medi-Cal or anything else, the most expensive time that they will be treated is at the end of their life. They estimate the cost right now for someone to be able to get this prescription at about $1,200 a prescription. So we would have to look at how many people might be inclined to use that. Certainly not as expensive as hepatitis C medication, certainly not as expensive as HIV medication, certainly not as expensive as chemotherapy. So this would be a one-time cost of about $1,200 if someone were to use this, as well as their copay if they should have one when they go to their physician not once but twice. So it would be hard to estimate, but we do know that the majority of the people who have used this in Oregon, and we have almost 2 decades of data on this, that the majority of people who use it are people of a higher socioeconomic background and often a higher educational background. So it would be very hard to estimate, but the cost, I think, would be well in line with whatever other health care needs the person might have.
Okay. And just a follow-up question. If this did become law, and would the legislature have to come back and authorize Medi-Cal to provide this, or would it be some other entity throughout Medi-Cal that could do it administratively?
It could be us, or it could be Medi-Cal administratively, is my understanding.
Okay. Thank you.
Okay.
But the federal government will not reimburse for it, so it would have to come from us.
Thanks.
Okay. Mr. Ting?
Just a quick clarifying question on the fiscal analysis. It just seems like there's an ongoing fiscal analysis of $250,000 by DPH and about the same for managed healthcare. Is that correct?
They didn't know complete file, but that's about what we're estimating.
Okay. And there's no other additional to our knowledge at this point. Okay. Thank you very much.
And again, I think that's for data collection, and I think we all agree that we need to collect the data that will paint us the full picture later.
Thank you.
Okay. Any other comments, questions? Any other questions? Okay, fine. I want to thank Ms. Eggman for presenting the bill to us today. I know this is a complicated issue. I want to continue to focus on the fact that this is the fiscal committee that's dealing with this issue much more than the policy. Those who vote today can be voting, obviously, probably on the fiscal aspect, but clearly there may be other reasons. I want to emphasize that because in many ways it does not bind folks when it gets to the floor, and we have to deal with policy. So we're a fiscal committee to make sure that it fits within the budgetary issues of the state, and the policy committee deals with the policy. So that's where we're doing that today. And that having been said, I want to thank those of you who came, Ms. Eggman, for presenting the bill, and I ask for the roll call for voting. I need a motion. I'm sorry.
So moved.
It's been moved and second. Moved by Mr. McCarty, second by Mr. Ting. Please call the roll.
Weber.
Aye.
Weber, aye. Melendez. Melendez, no. Bigelow. Bigelow, no. Bloom.
Aye.
Bloom, aye. Gomez. Jones Sawyer.
Aye.
Jones Sawyer, aye. McCarty.
Aye.
McCarty, aye. Obernolte. Obernolte, no. Ting.
Aye.
Ting, aye. Ayes 5, noes 3.
Okay. It takes 5 to pass in a committee of 9, so thank you. It does pass to the floor. Thank those of you who've come today. This meeting is adjourned.